So I'm making a video on oil pulling because I keep getting asked about it, and I just got a message yesterday, so I was like, going to answer, and then I just decided, you know what, forget it. I'm just going to make a video. I feel like it's a more personal way to discuss what I think, or I believe. So, first of all, I think it's imperative to note that always brush, always floss. Oil pulling is not a substitute for anything in that regards, but it has been noted that people claim, not my patients in particularly, but that it is actually really beneficial for your oral tissues, and it helps prevent bleeding and all this stuff. Your teeth get whiter, and I don't know, but all I do know is I'm an advocate for doing anything that is, going to improve your health. Anything that makes you feel better about yourself, right, Trevor? Don't you feel the same?
Oh, yeah.
I feel like that. Come here. This is going to be a dentist in here right here, so... Yeah, we got to get them. All right, so personally, I think that it's really imperative for people to be knowledgeable in taking care of their oral health before they just jump on the oil pulling train, because think of it. How many patients come in and they don't floss? I mean, they say flossing is they don't have time for it. Do I have time for it? I don't know. Do you have time for it? You have time for it. So he has time for it sometimes, and he's going to be a dentist. Sometimes. So let's be honest. How often do you floss? Right. So we're going to tell our patients, like, okay, so brush, floss, and don't forget to oil pull for 20 minutes. That's where it's kind of difficult, because I don't feel like a lot of people will be compliant with that. Honestly, kudos to you if you want to do that and you feel like it really benefits you. I mean, that's awesome. Maybe the benefits of losing 20 minutes in your day outweighs the fact that, I don't know where I was going with that. Oh my gosh. Okay. So anyways, whatever. Don't listen to him. He's crazy. Anyways, another thing, the evidence, based research that goes along with it isn't necessarily, it's not, clinically proven yet, I don't think. I think that there's just, studies that have been done. But you know what I think would be the best thing is to have a patient that, really believes in it and has been going to a dental professional or dentist, dental hygienist, wherever you get your teeth cleaned, whoever cleans them, to ask them, based on previous records, do you notice any difference in my oral health? Because they'd be able to tell you. They have a plethora of information based on your overall oral health, and they could tell you, I do notice that your pocket depths have decreased. You don't have bleeding anymore, stuff like that. So that would be the best way to really find out. For me, I even feel like I don't have enough time in my day. I get up at 4 a.m. to work out for an hour, so I don't know if I'd have time to oil pull. No, I'm kidding. I should try it sometime. I really plan on trying it for, just to see. Because people say after, the second time they notice a difference. Is that crazy or what? How do you know until you try it?
People probably think mouthwash, too.
No, people swear by oil pulling. Just be open-minded, okay?
Yeah, but you know how hard it is to clean off tartar.
Okay, that's the thing. People say that it gets rid of plaque, but they don't realize that there's tartar or calculus on your teeth that is so hard to get off with instruments. It is not going to get rid of that. It's not going to restore lost bone. That's things that I just would never believe. Because getting off tartar requires mechanical instrumentation. It does. Or power hand scaling. It's so difficult to get that off. It's fatiguing on your hand. It'd be a miracle. We wouldn't need dentists no more. I heard it.
Right. That's the stuff you need to go to the dentist for.
Right. So, you know what? Do it if it makes you feel good. If you notice, I heard it helps with sinuses and all this stuff, but don't substitute it for good POHI, good personal oral hygiene instruction, good home care. Gosh, I have issues. Please forgive me. No, good home care. It's not a substitute for that. So he makes me nervous. What can I say? All right, so that's all I have to say. If you have any questions for us, we're a dental team, so, you can holler this way.
Dentists make people nervous.
I know. He makes me nervous. He wants to pull my teeth. See, I don't know for me if I would notice any oral benefits because I have healthy, non-diseased tissue, and I have decently white teeth.
Yeah.
All right. See ya.